Lord Patten, we'll pick up the story in relation to the blood donor leaflet with your response to the submission. DHSC 0002309_027, please, Lawrence. This is a minute from Mrs. Walden, addressed to Mr. Clark, so MSH. The date is the 6th of July 1983, and it records Mr. Patten has seen Mr. Parker's submission of the 1st of July and has commented, "In my view, public concern on this issue is mounting, and rightly. The earliest possible publication seems desirable, and the Gay Medical Association could take the strain should more fringe-like gay bodies raise the flag of discrimination." Would it be right to understand, Lord Patten, that looking at this, your priority was just to get on and publish the leaflet?
Getting on with it.
And you say in your statement you don't know whether you had a specific time frame in mind, but you just wanted it to be got on with.
I didn't have a timetable, and I wasn't, I think, at that time aware of any decision trees and how it was all working behind the scenes. But I just wanted to get on with it, in quotes.
And would it be right to understand from the second paragraph attributed to you there that you weren't particularly troubled by the issue of discrimination or offending those in the gay community, because you thought those concerns essentially were outweighed by the need to have the leaflet available?
That's absolutely right, but could I just say, for the avoidance of doubt, I have a number of homosexual friends, some of whom have stayed in our house, and have always thought we should equally bend over backwards to look at all those sensibilities. But I did think that the overriding public health responsibility, which was what I was concerned with, was to get on with it and to use best endeavours not to offend people on the way.
Again, looking at it more generally, it might be said that it's inevitable that the blood transfusion service may have to discriminate. It may be on grounds of health or age or sexual practice giving rise to particular public health risks in order to provide as safe a blood supply as possible.
Yes, working out how it could best be done that the blood products which were produced and used by those people who needed haemophilics or whatever was safe.
Now, there was an exchange of minutes then over the course of July into which you weren't copied about methods of distribution of the leaflet. I'm not going to take time up with that because both Lord Glenarthur and Mr. Clark were copied into those and have given evidence about them. So I want to pick their matters up at the end of July 1983 with a submission that was sent to your private office. It's DHSC 0002327_016. So this is a minute from Mr. Parker, 29th of July 1983. It's addressed to, I think, Mr. Clark's private office, but we can see from the list of those who were copied into it, we see again the name of Mrs. Walden. So it was copied to your private office. And then if we go up to the text of the minute, we can see Mr. Parker says, "I attach a submission prepared in consultation with colleagues in Med-SEB, Information Division and CH Division, which seeks Minister's agreement to the printing, distribution arrangements and publicity for the proposed AIDS leaflet." And then if we go over the page, we can see under the heading AIDS, picking it up just below paragraph 2, we see the purpose of the submission. The submission seeks MSH's approval, so that's Mr. Clark, for printing the leaflet and the proposed arrangements for its distribution and his agreements to the texts of the statement and question and answer brief. Now, I just want to ask you, about the issue of how the leaflet was going to be distributed. And we'll look through this submission, and then I'm going to ask you some questions about that. So we've got the heading distribution of leaflet. It said there was a survey of regional transfusion directors. Opinion amongst directors was divided. No one method of distribution seemed to fulfil all the necessary criteria. Namely, one, that all existing and potential donors should receive a leaflet. Two, donors at session should not be caused embarrassment as a result of reading or even being seen to pick up the leaflet. Three, the method of distribution should be that which is the most effective in reducing the number of donations from high-risk donors. Four, there should be minimal administrative and resource implications. So those are the criteria. And then the submission continues. The two possible methods of distribution which were considered by RTDs discussed below in relation to these criteria. And so the first method of distribution or pattern is the issue of leaflets with donor call-up cards. And then various matters are set out in relation to that method. A, this could be expected to reach about 80% of the total donor population. In addition, leaflets could be sent in advance to donors booked on factory sessions. Walk-in donors would not be covered. Top of the next page, B, donors could read the leaflet in their own homes, thus avoiding any embarrassment. C, the supposition is that this method of distribution would be the most effective in keeping high-risk donors away from sessions, thus removing the temptation to proceed with donation in order to avoid embarrassment. D, this method has administrative and resource implications for regions, e.g., 1, several regions use postcard call-up. The inclusion of the leaflet would mean additional stationery and clerical costs. 2, regions with computerised call-up facilities would have to modify their systems. 3, this method would require twice the number of leaflets compared with the alternative method. 2 million leaflets at a cost of £16,000 would be needed for a 6-month period. Sorry, Lawrence, can we just go up to the top half of the page? That's fine. So, Lord Patten, before we look at the second method, would you accept that in relation to that first method, the arguments in support of that method are essentially it will be the most effective in deterring high-risk donors, but as against that there are some administrative and resource implications?
Yes, I accept that. I think always in ministers' minds at the time who were concerned, of course, with these particular problems in terms of infections being passed on, were also concerned to maintain the nation writ large blood supply and did not want to put off some long-standing members of that volunteer army of blood donors who might think just by virtue of coming along, even though all the instruments used were sterilised and used only once, that they might somehow get involved in catching something and put them off. And that was and remains, I think, a very important issue.
And then if we look at the bottom half of the page, the second method of distribution is a leaflet to be made available at donor sessions. And then there are, again, 4 points in relation to that method. E, it would be difficult to ensure that all donors received a leaflet and there could be insufficient time for it to be read prior to donation. F, there are many other circumstances besides the risk of AIDS which lead to a donor being rejected for donation on a particular occasion. Donors could be caused embarrassment if they felt their fellow donors had wrongly suspected the reason for their rejection. G, if a donor in a high-risk group were to read the leaflet immediately prior to or during donation, he might well be tempted to proceed with the donation rather than to risk the embarrassment of withdrawing at that stage. H, this method presents very few administrative problems and has no obvious resource implications for regions. It would require considerably fewer leaflets than the first option. So in relation to this second option, Lord Patten, leaflet to be made available at donor sessions, would you accept that in terms of the effectiveness of that method in deterring high-risk donors, it's a less effective method than the first? The sole advantage this method has is fewer resource and administrative problems.
Yes, I would.
And then if we go over the page, we see it said at the top of the page, and this is by officials, although it would be possible to achieve a near uniformity of method of distribution amongst directors, it is not immediately obvious which method is to be preferred. and then there's reference to directors' own opinions. Now, Lord Patten, it might be said that if you're prioritising safety over administrative and resource implications, it was pretty obvious which method was to be preferred, namely the first method, because that was going to be much more effective at deterring high-risk donors. Do you have any observations on that?
No, I don't think so. I think it was the best way of deterring high-risk donors, provided they faced up to what they were reading. And I don't know what studies of human behaviour have been done retrospectively on this. I don't know how well it did deter people. I suppose if people are deterred by virtue of the fact of this, we never would know anyway. But
and then the second paragraph sets out the official's recommendation that RTDs, so that's regional transfusion directors, should be given the discretion to decide for a trial 6-month period the most effective means of distribution in their own regions. So that was the recommendation. Leave it to the directors on a 6-month trial basis. If we then pick up your response, it's at DHSC 0002327_118. So this is a minute again from Mrs. Walden, 2nd of August 1983, setting out your comments on the submission. 1, I think that printing and distribution arrangements should go ahead as soon as possible with low-key publicity as suggested. Now, the as soon as possible is underlined, and my understanding is that's as it were your underlining being passed
I think
on
so,
by
it
Mrs.
was.
Walden. So again, is it right to understand that your priority was, again, just get on with it as quickly as you can?
yeah, and here I come in apparently, which I don't remember, with the suggestion, can all this be done by the end of August? I don't remember that, but obviously I was beginning to think about timetable, which going back to your earlier question.
And then the second paragraph, we need to do something and for it to be known that we have done something in case the worst does happen. Are you able to assist us in understanding what you meant there?
Well, we need to do something, I think, speaks to itself. That is, get on with the printing and distribution as soon as possible. And therefore, also to inform people that we are taking action. And it is very important that government is believed to be engaged and is looking after the nation's interests. And there's always the fear in my mind, I believe, and perhaps I'm varnishing retrospectively what I might have believed at the time, that there was a risk that there was going to be an exponential or near-exponential growth in cases over months or whenever, and therefore to try to set a deadline was a good thing. I've always thought, generally speaking, deadlines are a good thing.
So the reference to in case the worst does happen, that might be exponential growth in AIDS cases, or it might be transmission of AIDS by blood or blood products, or is it impossible for you to say now what you meant by that?
Well, I think the two are almost interlinked in my mind as to what you just said, but am I wrong on that?
No.
No.
Just trying to get the best understanding we can of what might have been in your mind, Lord Patten.
I mean, I thought if the levels of infection were to go up exponentially, it is important not just for self-protection reasons, but for people to know that we were trying to do something about it, and that as a part of that, it would be clear. Perhaps I should have been more explicit that therefore more infections would come, but that was in my mind.
And then your third point, is there any reason why directors could not follow both methods of distribution for the trial period? So that was your suggested solution, do both. And we can see, if we look at DHSC 0002327_.
Forgive me if I could just say that the words on the page, I think this was Mrs. Walden's time, was it? Yes. Mrs. Walden's time. I mean, she was an assiduous taker of what I said. And so this is clear. There's no speculation by officials or any officials or medical people coming in behind the arguments. That was what I said at the time, unvarnished.
She's reporting verbatim.
Absolutely verbatim, and she was very good at that.
And then we can see Lord Glenarthur.
May I just ask? This is the 2nd of August. When generally would you recall, Parliament would be in recess for the summer.
Before the 2nd of August.
So this was you exercising your ministerial responsibilities as a matter of some priority, because otherwise you might be expected to have something of a break, would you?
Yes. The fact that Parliament had risen did not mean that ministerial duties stopped. And I was doubtless in action in the department every day in the Elephant and Castle at that time. Working from home wasn't much favoured at the time, except the weekends when you were given lots of work to do at home when you weren't within the grasp of the system in the civil service to make you do it. But I mean, that was me in, as it were, a holiday month, but we all fought over slots as to who should have holidays, I remember, and naturally the Secretary of State came first and Ken Clarke came second, and all the rest, we were at the bottom of the pile, so I can't remember when I had a holiday that year.
Thank you.
And then if we look at what the next day Lord Glenarthur said, DHSC 0002327_120. This is the 3rd of August, and it's addressed to Mr. Parker from Lord Glenarthur's private office, copied to Mrs. Walden. And we can see it says, Lord Glenarthur's seen your submission of the 29th of July. He approves the text of the leaflet and statement. He's asked if we have a publication date in view. He's asked whether he or MSH should deal with any TV/radio interest. And then this. He favours using both methods of distribution and feels that the risk of embarrassment to potential donors is outweighed by the need to achieve wide distribution. Now, that looks pretty similar to your thinking. Would you agree?
Yes.
And then his addition, we may be at the tip of an iceberg with AIDS, find ourselves in trouble in 18 months' time unless we are really positive in our approach, even if it does embarrass a few gay people. Again, that seems to be similar to the views.
Yes, I wouldn't have used those actual words, but it's a similar approach.
Now, we know from other evidence the inquiry has heard, and the documents have been provided to you, but they weren't all copied to you at the time, that in the course of August, there were further contributions from Mr. Clarke in relation to the issue of distribution. I'm not going to take you through those because, again, the inquiry's heard evidence from both Lord Glenarthur and Mr. Clarke on that issue.
And I've read Lord Glenarthur's evidence. I said I haven't read Lord Clarke's evidence.
The upshot was that it was left to directors to decide which method to use. And if we go to DHSC 0002309_036, and this is from Lord Glenarthur's private office again, 1st of September 83, copied to Mrs. Walden, so copied to your private office. And it suggests, Lord Glenarthur suggests that if there's going to be this trial period of leaving it to the discretion of directors as to which distribution method they use, he suggests it should be 3 months instead of 6 months. And that is, as the inquiry understands it, the basis upon which matters then proceeded.
Directors in individual regional health authorities were in quite a powerful position. An awful lot of decision-taking was devolved from the ministry to them. And they again felt very protective because it was their world, rather like the nations, the 4 nations of the country feeling the same. And they did sometimes go down different paths.
Now, the decision having been taken that there'd be a trial period of 3 months, would you agree that it would be vital for that trial period to then be, the outcome of that in trial period to be reviewed promptly once the trial period is over?
Well, in theory, yes, but I can't remember what actually happened.
So I'll take you to the documents in that regard in due course. But
I haven't got the timing in my mind.
No, quite understandable, Lord Patten. But having you and Lord Glenarthur had suggested using both methods. The upshot, in fact, was that it would just be left to directors to decide. And then Lord Glenarthur essentially is trying to keep that to as short a period of time as possible, 3 months rather than 6. So
he obviously wanted to get on as well, which was good.
So it would be important to see whether in 3 months' time the experiment of leaving the method to directors' discretion, whether that had been the right course or not. Would you agree?
Yes.
If we then just go to DHSC 0006401_006, this is a press release on the 1st of September 1983. For present purposes, we need only look at the first paragraph, and it's just to give us the chronology. It says the Department of Health and Social Security has today published a leaflet, AIDS and How It Concerns Blood Donors. Now, would you accept that it took longer than it needed to get to the position of issuing the leaflet on the 1st of September 1983?
There's always this very difficult judgment to make, particularly retrospectively, between time taken, time reasonably taken, and where that slides across into delay, which is a sort of judgmental word at that stage, that there was a delay. I certainly think, and I believe I recorded that in my evidence, that I think we could have got on with it faster.
Yes, and I think if we pick it up as to how you put it in your witness statement, WYTN 5297001. Page 26. And it's the bottom of the page, paragraph 330. You've said this: looking at the matter now with the knowledge of the large numbers of those infected, it is of course the case that one can say that the leaflet could have been published sooner, that the distribution could have been more forthright, circulated both with call-up cards and at donor sessions, and the terms of the leaflet could have been stronger. You have to deal with the situation as it presents itself, including such matters as the reported difference of view between regional transfusion directors on the best method of distribution. Top of the next page. Nevertheless, I think my only other comment would be at the time I was impressing the need for the earliest possible publication. And does that remain your view, Lord Patten?
Yes. And I noticed also, if I may, Sir Brian, in some extra materials submitted to by the inquiry to me, which came in, I think, overnight Wednesday. No complaint about that, part and parcel of how business is done. But one of them, if I'm onto the right document, I don't remember what its name was an advertisement showing that actually printers could sometimes get on and work very much faster. I don't know whether that was true or not. It was from some local newspaper. It was an advertisement. But I would stress that in considering that issue, it may well be that there was government-wide contracts, as a matter of fact, between government and its departments and the stationery office or whatever, to be the body that conventionally, for security and a whole host of other reasons, would carry out leaflets, and it suggested that it may have taken 3 weeks, and there may be people out there who could have done it quicker if they had the capacity. I don't know, can't answer that question, but I think it's very important for me to say, not first order importance, but maybe third order importance, that ministers normally did not get involved, Sir Brian, in deciding that we use this or that company or urge this or that company to get on with it. That was kept apart from ministerial decisions for proprietorial reasons or alleged proprietorial reasons. Whether that was right or wrong is another matter, but I remember being drilled in this. You just don't get involved in that stuff.
And just, we don't need to put it up on screen, for the benefit of the transcript and for others, the reference to the document that Lord Patten's referred to is JEVA 00000120. But as I think you've made clear, you wouldn't have any direct knowledge yourself at the time of the arrangements that could be made for leaflets to be published quickly. That would be dealt with by the information division or officials at other levels.
And they would have thought that wasn't something you put in front of ministers.
And I should just, whilst we're looking at your statement, have referred back to page 25, please. Bottom of the page, paragraph 3.28. So you've set out a number of the documents that we've looked at, and then you say this: looking at these timescales now, my observations would be that, and then over the page, judged by today's standards of digital production, the 3 weeks of printing the leaflets, of course, appears too long, but in 1983 that period was difficult to avoid, and that's then the point that you've qualified in the way you just did. And then matters could perhaps have been pushed through more quickly in July than they were, though the issues being considered were rightly to be debated.
And there again, it's not a tautological point on the second bullet point there. Matters could perhaps have been pushed through more quickly in July than they were, though these issues were being considered, were rightly considered to be debated. And this is exactly to the point. I'm cautious about using the word delay. A lot of time was taken. Now, was it delay? Because that has got that inevitable pejorative judgment on it, and that's not for me to do, to judge whether it was a delay or just time necessarily taken. But I think that all other things being equal, which they never are, things might have been pushed ahead a bit faster.
Now, I'm going to turn next to another topic, but if we keep the statement up on screen, because I think we'll do this by reference to your statement. The next topic I want to ask you about is the line to take of no conclusive proof. And we can pick that up on your statement at page 28. Paragraph 3.33, you've set out the materials that were provided to you in which ministers stated that there was no conclusive proof that AIDS was transmitted by blood or blood products, or phrases to similar effect. I'm not, for present purposes, going to go through the documents themselves. The inquiry has looked at them on a number of occasions. I think it's right to note, however, that they're not documents that emanated from you. So we have an answer from Lord Glenarthur in the House of Lords. Bottom of the page, we have a letter from Lord Glenarthur to Clive Jenkins. So if we just go down to the bottom of the page, Lawrence. And then over the next page, the third document was a letter from Lord Glenarthur to Baroness Masham. Bottom of the page, the fourth document was a press release. That's the document we just looked at, in which there was a statement from Mr. Clark. And then top of the next page, reference there from another letter from Lord Glenarthur to an MP. And what you say at paragraph 3.34, towards the bottom of that page, is, whilst none of these examples is of documents originating from me, I think I may have been aware at the time that the line to take involving no conclusive proof was being used. Now, as I understand the evidence in your statement, Lord Patten, you don't know where that formulation came from. Before
my time. It was in the zeitgeist at the time, in the department.
And you don't know how and when the decision was in due course taken, and we know it was taken by a date in 1984, to stop using that line to take?
No, that suddenly emerged in rather a low-key way. But that's correct on both of those.
So do you have any sense of whether that line to take, you think, may have troubled you at the time?
I cannot remember that. I took it as being, as it were, the line to take developed before I came, and this is what had been said by someone was what we had to say. And remember that junior ministers are quite often told what they've got to say, and accept that. So I can't answer any more than that, I think.
If we just go back to that one of those original documents you saw from Dr. Wolford, DHSC 0002309121. Under the heading background, the second paragraph begins, although there is no conclusive evidence, it seems very likely that AIDS is caused by an as yet unidentified virus. So in this document, Dr. Wolford, although using a very similar phrase, no conclusive evidence rather than no conclusive proof, but nonetheless goes on to qualify that by saying in terms, it seems very likely that AIDS is caused by an as yet unidentified virus. And then, as we saw earlier, she talks about the particular risks for those who may receive blood or blood products. Now, the various statements of the line to take, which you've set out in your statement, don't contain anything equivalent to but it's very likely that AIDS is caused in this way, or very likely that AIDS is transmissible by blood or blood products. Looking at it now, because I recognise you don't know what you have no recollection from the time. Looking at it now, do you think that the line to take wrongly downplayed the risk?
I'm not at all costs dodging the question, but people can sometimes read into phrases that which they believe and that which they don't believe. I can also, and it's important to reflect that at the time there was, I think, scientifically no conclusive peer-reviewed in the scientific sense. And I'm not a scientist, but I know what peer review means from another part of my past life, in academic life. And there is, I believe at the time that this was written, that AIDS was likely to be caused by an as yet unidentified virus, and changing those words to it is certain that, I don't think retrospectively at that particular moment it was certain, because I don't think the evidence was there. I like to think that Mrs. Walford, who was, as I said before, in an admiring rather than pejorative sense, I remember her being, I can't put a face to her, very forceful in what she said. I don't think she would have rolled over if there was evidence there to say that we are absolutely certain, to put in those grace words saying on the one hand, on the other hand. So I am in some difficulty in trying to apply a retrospective judgment in this, and I would need, I think, to do that, to have some sight of, on the face of pages of analysis of what the science at the time was really saying.
If one begins with the proposition that Ms. Walford Dr. Walford had accurately stated what the effect of the science was, certainly that must have been what appeared to her if she was to write this. As a matter of language, the statement is it's very likely that AIDS is caused by a yet unidentified virus. And the although is the qualification to that. It's not yet certain. There's no conclusive evidence. That, as a matter of language, is what she's saying, isn't it?
Well, that I should read it as it seems very likely that AIDS is caused by
an as yet unidentified virus, although it's not certain, although there's no conclusive evidence. Because although...
I mean, it would have been better if those words were there.
Well, if they'd been that way around, possibly. But it is a statement with a qualification, is what it is, as a matter of language. The question then arises is whether the line that was then taken or developed somehow and was rolled out by the various ministers and others who spoke was just the first part. There is no conclusive proof. There's no although, there's no statement of the principal point, and that this is the qualification. It was simply the qualification. And technically it may be right, there is no conclusive proof. But the question is how it might have been heard, perhaps, which is one for the judgment of myself, having listened to submissions as to how it might have been heard by the person reading it.
Well, I'm certain that these reflections would have gone through the mill of discussion with other scientific advisors and policy advisors, with much in old-fashioned language, tooth-sucking about, are we getting the balance right? Are we saying the right thing? But I also think, reflecting on what I remember of Dr. Walford, that if she'd been told to soften something, I don't think she's the kind of person that would have softened something. She would have pushed back. So in the light of what she knew at the time, she was obviously concerned by the limits of the scientific evidence that was in front of her. And I have some sympathy with her.
Yeah.
And then if we just pick up your reflection on this issue in your witness statement, Lord Patten, so if we can go back please to the statement at WITN 5297001, and if we go to page 32, at paragraph 3.39, you've said this: the inquiry invites me to reflect on the use of the phrase and the fact that its use was maintained until December 1983. As I have already indicated, and that's a reference to the previous page, in particular paragraph 3.37, a better balance could have been struck in the wording, and I think it's also right that the wording should have been amended sooner. And then you go on to say you can't say what impact that had on public understanding.
No, I can't.
But again, is it right to say that at least looking at it now, your view is that the line to take should have struck a better balance? You used could have there, but would you accept it should have struck a better balance?
Well, I think it's could was the word I used.
Yes, absolutely. I'm just pushing Lord Patten to see whether you would accept it should have struck a better balance in order to be more faithful, indeed, to what Dr. Walford herself had said in her initial briefing.
It's not weasel words, I promise you, but I must sometimes muddle up could and should as being sort of interchangeable. But I take the point. I certainly, as you know, wished, generally speaking, as a cast of mind to get on with things. I can't quite understand retrospectively how long the language was allowed to be used. So should, could, yes. But I simply don't know whether people were reading carefully what an NHS press notice said and how much that sort of thing got through to the general public as reported by the press corps.
That's understood, Lord Patten. Can we then move to a document which is at CBLA 00000, it should be 5 zeros, Lawrence, 43_040. Now, this is a letter dated the 9th of May 1983, so it's sent obviously before you took up your post in the Department of Health. It's addressed to Dr. Field at the DHSS, and if we go towards the bottom of the page, please, just go further down, we can see it's from N.S. Galbraith, and that's Dr. Spence Galbraith, who was the director of the Communicable Disease Surveillance Centre. And you'll see he set out, if we just look at the text of the letter, he set out in the first paragraph reports about cases of AIDS, one in a haemophiliac in Cardiff. He refers in the Lancet to 3 cases in haemophiliacs in Spain being reported. and a tally of 11 reported cases of haemophiliacs in the USA, and a paper describing a case in a multiply transfused child in the USA. And then he says this: I've reviewed the literature and come to the conclusion that all blood products made from blood donated in the USA after 1978 should be withdrawn from use until the risk of AIDS transmission by these products has been clarified. And then he appends a paper in which he sets out his reasons and suggests perhaps there should be an early meeting. And then finally says, in conclusion, may I say that I'm most surprised that the USA manufacturers of the implicated blood products have not informed their customers of this new hazard. I assume no official warning has been received in the United Kingdom. And then if we go over the page, and I'm not going to go through the detail of his attached paper, but we'll see under the heading Action on AIDS, he proposes the temporary withdrawal of all blood products imported from the USA, made from blood donated after 1978, until the risk of transmission of AIDS becomes clarified. And then sets out his reasons. So this is a leading epidemiologist, public health specialist, saying to the Department of Health, from his perspective as director of the Communicable Disease Surveillance Centre, there should be a temporary withdrawal of the imported products until we know more. Now, there's no evidence that you saw this.
No.
There's no evidence.
Pretty certain. All I've seen about him is that very caring and admiring obituary in The Guardian, which was put in front of me, that he was obviously a formidable scientist and knew what was what in this area. And that people should have listened. I mean, that's what I got from The Guardian.
Yeah. And the reference to that, we don't need to put it up on screen, is RLIT 0001119. So there's no evidence that you saw this, Lord Patten, and the inquiry's not yet seen any evidence to suggest that any other minister saw this.
There's no evidence that any minister ever saw it.
That's correct.
I certainly didn't.
Yes, I think that's a fair representation of the evidence the inquiry's heard to date. So looking at it now, do you consider that this is the kind of material that ministers should have been informed about?
Yes, unequivocally. And if I saw it, forgive the colourful language, I think I probably would have pressed the panic button, because it was the information given at the time was a broad range of knowledge showing detail about what was happening with the FDA and the USA and what was going on in Spain and all the rest of it. Now, to the best of my knowledge, I never saw any of that information in front of me in my time.
And would you expect this also to have been seen by the Chief Medical Officer? I should say it may not be clear one way or another at the moment whether it was seen by the Chief Medical Officer, but so I'm asking you a hypothetical question. Is this the kind of material that you would expect to go to the CMO as well as to ministers?
I simply do not know, truthfully, what the rules and practices of what should go before CMO, because there were some other very talented deputies who've been there for years. I simply can't answer that question, because I don't understand what their mechanisms were.
And again, following it through hypothetically, because you and your ministerial colleagues didn't see this, but would it at least, you said
collectively... Who was in office, sorry to interrupt you, do beg your pardon, who was in office as CMO at that particular time?
May 1983 was still Sir Henry Yellowlees.
Aha.
I can't remember off the top of my head the precise date when Sir Donald took over, but it wasn't as at May 83.
Sir Donald took over in 84, was it?
Yes. I think so.
I think.
But it was certainly Sir Henry Yellowlees.
I do not know how much Sir Henry Yellowlees delegated.
And so you collectively said you might have wanted to press the panic button. Would it be right then, again, looking at it on a hypothetical basis, looking back now, you would perhaps, you'd have certainly wanted to know more, presumably?
Yes.
And to have investigated fully the reasons that Dr. Galbraith was putting forward?
I'm sure that I would have raised it, and having carefully read this, I'm sure I would have raised it by a minuted request and not just a side conversation, because it seems to me so fundamental that the information that being put by the late Dr. Galbraith And the breadth of it's the thing that struck me, knowing what was going on in bits of Europe. Did the department know that all that was happening? I don't know. They should have done, I guess, having had this. And I don't know quite where this information had been buried. Sorry, that's speaking colloquially again. You know what I mean?
Yes. And we have some information as to what officials within the department did or didn't do, but I'm not going to ask you about that because you didn't know any of that at the time.
No,
it's
none
really
at all.
Your instinctive reaction to it that I was interested in.
And I'm sure Simon Glenarthur would have reacted in exactly the same way. He was assiduous at considering these things.
There was then there was consideration of the question of what should be done in relation to imported concentrates by a committee called the Biological Subcommittee on the Committee of the Safety of Medicines, and you've addressed this in your witness statement.
Yep.
So if we go back to the statement, please, Lawrence, WITN 5297001, page 37. We've got the heading halfway down the page, meeting of the Biological Subcommittee of the Committee on the Safety of Medicines, 13th of July 1983. And you've set out there various documents that the inquiry provided to you, which relate to the material that was prepared for the purposes of that meeting and then the conclusions of the meeting and the minutes of the meeting. Again, I'm not going to go through the detail of that with you, Lord Patten, because the short point, as I understand it, is you saw none of this material at the time.
Correct.
What you say in your statement, if we go to the next page, at paragraph 3.53, you say this: looking at things now in the round, given the importance and profile of this issue, I think that it would have been appropriate for the CSMB consideration, so that's Committee on the Safety of Medicines Biological Subcommittee, / decision, to have been the subject of a submission to ministers, which in this case ought to have been to Lord Glenarthur. So again, looking at it with hindsight, which is all you can do because you weren't shown this material at the time, you think it should have gone to a minister and the right minister.
Doubt. I strongly feel that. I mean, I think sometimes Simon Glenarthur, I'm jumping forward to material you may or may not consider about building the new blood products laboratory. And suddenly the blood products laboratory put out material, which comes in documents later on, about how this new building would get into heat treatment and all the rest of it. And he was never told about that at the time, and I protested on his behalf that I think he should have been. So sometimes, frankly, mistakes are made. And I think it should certainly have, and I find it very hard to understand why this matter wasn't submitted to ministers.
The next issue which I want to ask you about, again, really from this same time period, mid-1983, so whilst you're new in office. Very new. It relates to a recommendation of the Council of Europe's Committee of Ministers. So we can pick this up at MACK 0000307. 4 zeros. MACK 0000307. If we go to the second page, we'll see the heading there, Council of Europe, Committee of Ministers, recommendation number R838 of the Committee of Ministers to Member States on preventing the possible transmission of AIDS from affected blood donors to patients receiving blood or blood products, adopted by the Committee of Ministers on the 23rd of June 1983. So that's what this document is. We can then see it says the Committee of Ministers, and then there's various matters it considers, and recalls, which I don't need to go through, we can then see its recommendation at the top of the next page.
They are still using the language of may,
Yes.
aren't they?
Yes. I think that's
May be caused.
I think that's a fair point. May be caused by an infectious agent transmissible by blood and blood products is the term used. And then we can see the recommendation here recommends the governments of member states, 1, to take all necessary steps and measures with respect to AIDS, and in particular, and then you'll see, Lord Patten, there are 3 matters set out: to avoid wherever possible the use of coagulation factor products prepared from large plasma pools. This is especially important for those countries where self-sufficiency in the production of such products has not yet been achieved. 2, the second point is to inform attending physicians and selected recipients, such as haemophiliacs, of the potential health hazards of haemotherapy and the possibilities of minimising these risks. And then the third is to provide all blood donors with information on AIDS so that those in risk groups will refrain from donating. And it appends an example of an information leaflet. So of those 3 steps or measures recommended, the third obviously relates to the question of providing some form of blood donor leaflet, and we've talked about that, and I don't need to ask you anything further about that for present purposes. But the first 2 recommendations are the ones I just want to pick up with you. So we can see the first is avoid wherever possible the use of coagulation factor products from large plasma pools. And the second is to inform attending physicians and selected recipients such as haemophiliacs of the risks. So 2 measures there: try and avoid the use of these concentrates,
Sure.
and tell doctors and tell the patients, the haemophiliacs, of the risks.
The risk assessment.
Yeah. So that's the recommendation of the Council of Ministers. If we go to a minute sent to Mrs. Walden, it's at DHSC 0002309_086. It's a minute from Mr. Cumming, July 1983, and we can see it's addressed to Mr. Lupton and then to Mrs. Walden. Paragraph 1 explains that from time to time...
Please, forgive me interrupting. I presume PR/stroke/off is the press office, is that right?
Private.
Oh, private.
Private office, yes. That's your private secretary,
office.
Mrs. Walden. Yeah.
Yeah, I've never seen that particular rendering of private office. Sorry, forgive
You know,
me.
you're absolutely right. It's not normally written that way, I think, on the document.
Oh, good. Thank you.
Paragraph 1, from time to time we submit to ministers international instruments which involve DHSS interests. It is normal practice during the preparation of these documents to ensure that the UK is not committed to policies which would not otherwise be followed, so that there is correspondingly no action to be taken if and when they're adopted. 2, however, recommendations or undertakings in international agreements are often of interest to pressure groups, etc., and it's thought that ministers may wish to be aware of recommendation R83/8, which was adopted by the Committee of Ministers of the Council of Europe on the 23rd of June 1983. 3, the subject of the recommendation is the prevention of transmission of AIDS from affected blood donors to patients receiving blood or blood products. On the basis of present knowledge, it's assumed that AIDS is transmissible by blood, and the recommendation aims to ensure that appropriate precautions are taken in the preparation of certain blood products. And then I'm not quite sure what that word is that's there written in. It might just be and. That specific groups of recipients, such as haemophiliacs, are accordingly reassured. 4 then refers to an information leaflet, the one that was appended to the recommendation. And 5 asserts that the recommendation doesn't prevent the UK from continuing to import factor VIII concentrate. And then 6, a copy of the recommendation is attached. So it would appear from this fairly clear that the recommendation made its way to your private office.
Yes.
At some point in July 83. There's no precise date here. I think you've said in your statement you can't be sure if it was specifically drawn to your attention by your private office.
Also correct.
I don't know whether you can answer this, Lord Patten. Do you think it's more likely than not that it would have been drawn to your attention given that you'd expressed a particular interest in AIDS?
I simply don't know.
And then in your statement, we can leave the document up on screen, I think, but in your statement, you say, in general terms, you would have expected officials to ensure that the UK action in response to the AIDS risk in blood was in conformity with recommendations of this kind unless there was a necessary reason to depart from it. But you don't know yourself what, if anything, was done in response to the recommendation.
No, I'm afraid I don't.
Can we just go back to the recommendation? So MACK 0000307, page 3. And if we just zoom in on the top part of the page again. If we take the first recommended measure, first of all, of avoiding wherever possible the use of coagulation factor products. And again, I'm asking you hypothetically, Lord Patten, because as you've explained, you don't know what was or wasn't done at the time in relation to this. But given that that was the recommendation, and given that your expectation was that unless there was a necessary reason to depart from it, the UK should be endeavouring to comply with this, would you expect that somewhere within the department, someone should be working out whether there were steps that could be taken to comply with this recommendation and assessing the feasibility of each of those steps?
Well, I certainly hope so they were. Otherwise, I wouldn't see the point of officials going to Geneva and us taking part in it. I would have hoped that they did. Of course, at that time, the UK wasn't self-sufficient, was it, in blood products?
No.
We was about 50% self-sufficiency, I think, from memory.
Yes, no, you're absolutely right. The UK wasn't. So it was, according to the recommendation, therefore particularly important. And then in relation to the second measure, that's about ensuring that both doctors and patients, and in particular haemophiliacs, are informed of the risks. So would you expect that, again, that someone within the department somewhere would at least try and investigate and assess the extent to which both clinicians and patients were up to date and informed of those risks?
Well, I would have expected that was part of their day job to do that. Is there evidence that nothing happened? I'm sorry, I'm asking you a question. It's not my...
That is certainly an inference that the Chair may be asked to draw from the available documents, if I can put it that way.
It just seems to me to be pretty strange that it wasn't thoroughly reviewed and information brought forward to someone that we should be doing this, because, after all, we were endlessly debating in real time, more or less at the same time, about what the AIDS information leaflet was to look like and what was to be there. So it isn't as though the idea of informing people, after all, we asked regional health directors of blood transfusion services to inform people about things according to one way or both ways. So there's obviously some gap in the relationship.
And as far as you're aware, and this calls on your general knowledge of the Department of Health rather than it being limited solely to this issue, was there any fundamental impediment to the department issuing advice or guidance or information either to doctors or publicly for the benefit of cohorts of patients about public health risks?
No, I think normally that was what the department thought it was about. Although there were considerable inhibitions, not just by ministers, I think by civil servants, that, getting into details of personal behaviour in private settings was something they didn't want to get too involved in, for ministers being thought to advising people about how to conduct themselves in their private lives, which I still think is there in some people's minds.
And then moving on to a slightly different topic, if we go to your statement, no, in fact, if we take it from the original document, it's DHSC 0006401_005. Bottom half of the page, left-hand column, under the heading Acquired Immune Deficiency Syndrome.
Yeah.
We have Mrs. Dunwoody asking the Secretary of State how many people have died from AIDS in the UK and how many of these people were haemophiliacs. I should say the date of this is 11th of July 1983, and this is a written answer. And then the written answer is the Communicable Disease Surveillance Centre, in collaboration with microbiologists, clinicians and the Office of Population, Censuses and Surveys, has been undertaking surveillance of acquired immune deficiency syndrome since September 1982 up to 7th of July 1983. 5 male deaths have been reported, none of which were haemophiliacs. Now, do you know whether... So that was information you were obviously given for the purpose of answering a specific written question. More generally, do you know whether you received or colleagues, ministerial colleagues, received regular statistical updates of the numbers of patients, numbers of people infected, or numbers of deaths?
I don't recall that ever happening in terms of, a monthly rendering of the population who had acquired immune deficiency syndrome.
I'm going to move on now to the revision of the AIDS leaflet. So
Yes.
in the course of 1984 through into early 1985, there were deliberations which led to a revised blood donor leaflet being distributed. Again, we've gone over a lot of the documents with other witnesses, but there are a handful I want to look at with you, and we can start, I think, on that before the lunch break. If we pick things up at DHSC 0002309_039. I don't propose to go through the detail of this, but this is just to give you, Lord Patten, a sense of the chronology. So we can see this is a minute of the 28th of March 1984. The 3-month period, the trial period, would have come to an end at the end of November 1983.
Right.
Beginning of December 1983. So this is now some 4 months on from that. And what we can see here is a AIDS leaflet, but the AIDS leaflet that's being contemplated here is a different AIDS leaflet. If we go over the page, top of the page, under the heading Summary, it says, I'm seeking MSH's agreement to our asking the HEC, that's the Health Education Council, to prepare a leaflet aimed at checking the spread of AIDS by encouraging male homosexuals to modify their sexual behaviour. So this is a draft submission looking at a different type of leaflet, but if we just go back to the minute on the first page.
Incidentally, I think, nudged my memory there, that I was ministerially responsible for the HEC because it was concerned with lots of other things like diet and not drinking too much and all the rest of it, and I think that fell into my area of responsibility. But obviously there's a complete read across into the AIDS issue.
Yes, I'm afraid I can't confirm whether I know that to be right or not, Lord Patten, but that may well be right. I just want to pick up what's then said in this second paragraph of this minute. So you can see it's a submission that refers to this different Health Education Council leaflet. But then the author says, I'm copying this to Dr. Smithers and Mr. Winstanley in view of the reference in the draft to the blood donors leaflet. I was not, as you know, at the DCMO's meeting, so that's Deputy Chief Medical Officers meeting on the 6th of March, but believe that there was some suggestion that this submission, i.e. the one about the Health Education Council leaflet, be used as a vehicle for bringing ministers up to date on where things stand in relation to distribution of the blood donors leaflet, question mark, and possible revision. First of all, do you know anything about whether there were regular Deputy Chief Medical Officers meetings? Was that?
No. What I do know is that happily, medical officers changed posts much less regularly than civil servants, where there was quite a roundabout of appointments and reappointments. I notice here that Mr. Fanning saying that please send on stuff to Mr. Cunningham. People quite often moved post in, a couple of years from one job to another, and that was the system. It helped with your promotion, but that also meant that there wasn't always that collective memory, whereas I think the medical staff tended not to be turned over very quickly in terms of responsibilities, which was a good thing. But I can't answer that question.
The second question, just emerging out of that main paragraph, is the reference to the submission on the Health Education Council leaflet being used as a vehicle for bringing ministers up to date on the distribution of the blood donors leaflet. Now, it might be said that's somewhat curious. Can you think of any reason why a submission couldn't simply have been made directly to ministers about the blood donors leaflet and whether distribution methods needed to be changed and whether the text needed to be changed?
Or by the HEC?
No.
Beg your pardon, I didn't quite understand.
I'm sorry, my fault entirely, Lord Patten, for not making myself clear. The HEC leaflet would be really an entirely separate matter aimed at dealing with sexual activity, essentially. Nothing to do with donating blood. It's the slightly curious reference in the second paragraph to using the HEC submission as a vehicle for bringing ministers up to date on the blood donors leaflet. Is there any reason you can think of as to why officials couldn't simply have gone direct to ministers about the blood donor leaflet as soon as they were ready to?
No. No reason that I can adduce.
And then if we go to one further document, perhaps before lunch, DHSC 0002321_044. Now, this is a submission, a minute, that's addressed to your private office, addressed to Miss McKessack. It refers to the Medical Research Council Working Party on AIDS refers to an attached minute. Do you know why the updates about the MRC Working Party on AIDS was coming to you?
No idea at all.
So you don't know whether, for example, whether the MRC was part of your responsibility?
I don't believe so. I think it may well have been a mistake, but I've no idea. It's surprising to see it. It's the first question I asked when I looked at it. Why would it have been sent to me?
And then if we go over the page, this is the first of 2 pages of a minute dated the 17th of April 1984, and it's addressed again in part to your private office, to Miss McKessack. And I don't need to go through the detail of the update about the Working Party on AIDS, but if we just go to the bottom of the page, under the heading Publicity Blood Donors, it says, ministers agreed last year that a leaflet should be issued to blood donors about the dangers of those at risk of contracting AIDS giving blood. There has been a 6-month trial of this leaflet, which has been successful. The leaflet and method of distributing it are under review. Now, the reference there is a 6-month trial.
I was just going to ask you, I thought it was 3.
Well, that's certainly what Lord Glenarthur had recommended, and what we understand, I think, so far from the evidence was
I wonder
put in
why.
place. So it appears that some at least may have been labouring under a misapprehension that the trial was 6 months. Do you know whether that's something that, or do you think you would have noticed that at the time?
Well, I don't think I did notice it. But it stood off the page when I looked at it now, because I just remember we were talking about 3 months versus 6 months, and I was very surprised to see it there.
So I note the time that there's a handful more documents to look at, which will take longer than a few minutes. So perhaps we could, on this issue, so perhaps we could take a break for lunch now.
Yes, well, let's take a break now, since it's 1 o'clock, and come back at 2 o'clock.